Okay, we're good to go.
Okay, we're live. Hi, everybody. Welcome to our COVID-19 information exchange webinar. Really glad that we're all getting together and being able to sort of chat about this. It's sort of a daunting time, and I guess we at NEMA were thinking, as this crisis hit us, and we thought about this actually last week. It seems so long ago. But we thought it'd be good to convene everybody just sort of initially to get a sense of what we're doing, what our fears are, and so forth, and to hear from a public health official on what's the lowdown. Before we get started with the introductions, though, and everything, what I want to do is just do a little bit of a housekeeping items, and Heather's on with us from the NEMA team to sort of make sure that everything is going well and we can field questions and the like. But what we're asking you to do is our agenda today is really, I'm going to talk with Dave a little bit and get a sense of where we are from the public health perspective. You guys, feel free to ask questions as we go. And the way to ask questions is at the bottom, the little toolbar, you'll see Q&A. And hit that, and that'll give you a sense or an opportunity to ask your questions through that. You can use the chat, of course, to talk to each other and sort of, give your opinions and whatever, but we'll be looking at the Q&A box for actual questions, and Dave and I will, try to triage those and get those answered as best we can. And I have to warn you, this is my very first webinar that I've actually done. I've been doing a whole bunch of web meetings, but this webinar is different. But I thought, okay, let's be creative, and I'm going to do some polls. So we're going to start with poll number one. Let's see how this works. So I'm launching poll number one. Okay, and my first question to everybody is, my museum is closed to the public, open for regular hours, open partially, or I don't work in a museum. So go ahead and vote. Hopefully everybody can see this and vote as we get started. That'll give us a sense of where we are with things. And am I doing this correctly? I'm not seeing anybody voting. Reviewing questions.
I can't actually see the poll down, and some people in the chat are also saying the same thing.
See the poll. I wonder why they can't see the poll. So one person said that they're closed to the public. Poll is not visible.
Nope.
I wonder why that is. Well, so much for polling. We'll have to get better at this. Somebody voted, though. I didn't.
Most of the people are saying that they're closed to the public right now. So.
Yeah. All right. Fine. Who needs these polls? All right, I'm going to end the polling. And wait, I'm going to relaunch it. Let's see what happens when I relaunch. Continue. Allow panelists to vote. I'm going to do that. See if you guys can see it. All right,
now I can see it.
Okay. Whoa. Okay, that did something. So is everybody a panelist? No. Oh, whatever. Okay, so there we go. All right. And so 60 people of 91. Okay, so I'm going to end the polling and see how this goes. Thanks everybody and I'm going to share the results. What's that look like? So everybody can see it. 86% of us closed to the public, and 4% of us open partially, and a few of us don't work in the museum. So we can all see that? Cool.
Yep, we also have some people that are probably just closed for the season as well.
Yeah. Okay. So, Dave, it's really my great pleasure to introduce Dave Reed. Dave is the Vice President of Ambulatory Care and Medical Oncology at the Dana-Farber Cancer Institute in Boston. And the reason he's here today, besides that great title, is he is on the board of the Essex National Heritage Commission along with me. And this connection was spawned. He's been on the board. We've been on the board together for some time, but last Thursday, it seems like so long ago, we had a board meeting. Mm-hmm. And Dave was terrific in terms of being, able to give us on that board sort of an overview of where we were as, generally with the entire pandemic situation. And then we had a really robust discussion as a group about, what Essex Heritage can and should be doing to sort of, continue its operations, find relevance and all that. And I thought this would be a great opportunity for us as the museum community to have a first go around just sort of talking about the pandemic, where we are with things, and then sort of what our concerns are. And my intent here is not only to sort of help everybody have some information that they can use personally and professionally, but also launch just sort of some ideas so that we know as NEMA what are the concerns. And as we move forward, our main intent, of course, our mission is to, connect the museum community, and that's what we intend to do over the coming weeks, is try to continue to be the organizational glue behind us. And so the more we know about what's on your mind, the better we're going to be able to serve you. So, Dave, thank you so much. I'm so grateful that you're spending a little time with us, because I'm sure your days are very packed with things. And I guess the first question, just turning it over to you, you're kind of the boots on the ground for us as the museum field right now, and give us a sense of where we are with, the whole pandemic from a public health standpoint.
Sure. Yeah. Thanks, Dan. Yeah. So it's, as I think everyone knows on this call, it's changing every day, usually several times a day. I think we are actually, because of the lack of testing units and the ability to test, we can't accurately answer that. We think that given the number of cases that have been positively diagnosed, at least in Massachusetts, and if you extrapolate that to the whole population, they feel that at least about 6,500 people are infected. The main issue with this virus seems to be that people can be carriers and not be impacted or feel like they might have a cold or no symptoms at all, and give it to elderly or kind of vulnerable populations. At Dana-Farber, we're of course focused on protecting our immunosuppressed patients, and many cancer patients are immunosuppressed. So we have to be extra due diligent on how we interact, where we interact, with who we interact. And so we've basically gone to an all Zoom platform for most of our meetings. It changes everything. Cafeteria. We have to be here to treat our patients, but at the same time, for non-essential personnel, they're working from home. Not too unlike you folks or the general public.
Yeah. So what's the scene at the hospital right now? Is everything kind of calm, cool, and collected, or in your case, it's a little bit of a different place because it's specifically for oncology, I guess, right? And it's not for general population. But what's the mood, and what is the what are professionals doing right now?
We're physically connected to Brigham and Women's Hospital and Children's Hospital, and our attending staff, MDs, rotate over there to see patients. So there's a heightened level of sense of security. There's a lot of our Dana-Farber as especially since we won the Nobel Prize last year, we get a lot of out-of-state and a lot of out-of-country business. That's basically dried up because patients now can't come from out of state or out of the country. So there's actually some capacity here, but there's still a lot of anxiety. And patients, the virus is one thing, but if you get diagnosed with a very bad cancer, and the reason someone would come to Dana-Farber is if they have a cancer that keeps metastasizing or coming back or needs to be on a clinical trial. So patients still want to get in here, so we need to have care providers in here. And they're also understandably worried too about the virus.
Is there a sense of like a protocol being set up for all hands on deck so that physicians are being pulled from their normal duties to sort of treat the virus in a wartime manner?
Yeah, we do. We have screening methods. So one, we don't want to necessarily bring in someone who's just worried or a little bit overly concerned. We have a rigorous screening method to make sure that we only see the patients who need to be seen and who should stay home, but also we're trying to admit patients who do have COVID-19 symptoms, and that testing is being done over at the Brigham at this point, which is the next bill to us.
I'm sure that the testing is on everybody's minds right now. Just in terms of, what do I personally do if I feel like I have it and so forth. And so, what is the protocol right now? Like, what are people doing if they feel? And I guess maybe back up. What are potentially, when you feel a certain way, this is when you should go try to get testing. And if so, what do I do?
Right, that's a great point. So you should not just march into your primary care doctor. You should set up, they'll do a screening over the phone and they can tell you where to go. There's some places that have drive-through facilities and some places that you'll go to get tested. And the state is also increasing the number of facilities that are able to accurately perform the test. We do a lot of collaboration with the Broad Institute in Kendall Square, and they're going to start doing testing soon.
Mm-hmm. But at this point,
you shouldn't direct your museum goers or family or yourselves there. You need to get approval to go there, and you should always, of course, wear a mask if folks when they are going there.
An approval from your primary care physician?
Yes.
But I suppose, I mean, our audience here is all over the place, at the very least New England, but we usually have some, folks from around the country on these calls. I don't know if that's true today, but it's really kind of a patchwork, right? At this point, in terms of how people are tested and what the response is?
Yes, that's right. And it might differ by state to state. We're just going by what we learned from the state of Massachusetts. Yeah, you should check in. Every single state that I've seen online has a COVID-19 aspect to their state website now. So right on the front page. So you should check there. This again, this virus is unique. What we're trying to, people are being better about staying home. Less traffic, the restaurants are closed. It's a big credit to our governor, Charlie Baker, for doing that. I think there's a lot of lessons learned. As I think I mentioned to you, Dan, I was over in China for work in November, and right after that, they really kind of locked the country down, something we haven't done here. But with the bars and restaurants closed, it's a real credit to our governor for how he's our state.
Well, you mentioned China, and I guess I was interested in learning whether there are any lessons that we could be taking away from what's happened in China and Italy and Europe and so forth. I understand that, as it's progressing, we're like a couple of weeks behind them in terms of the actual curve of the actual epidemic itself. And, are there things that we can and should be doing, and how has it happened, or how's it rolled out over there that we can be learning lessons?
Yeah, it seems like China, once they realized this was a significant thing, they went on a real a countrywide lockdown where people had to stay home, couldn't go out. They had they could be a drone flying down the street with a temperature gauge on it to take people's temperatures. My colleagues over there who I know, they were getting like per family, 3 passes per month to go to the grocery store, and you had a 2-hour window where you had to be back. You go to the grocery store. We haven't enacted those types of restrictions here, but that's how China helped. And they really lowered their number of new cases. Wuhan was at their peak was having about 1,000 patients a day diagnosed with COVID-19.
Wow.
Down to now 20 a day. So they really dealt with it. Italy, I think we're learning from them. They didn't take it so seriously at first. People were still going out in bars or restaurants until they had a huge problem, especially in Milan. The mortality of this virus in Italy was about 6%. And in some areas of Milan, it was up to about 15%. So they really taking it seriously, and the rest of Europe and the United States is doing that now.
Although I thought I read somewhere not long ago that still half the country is kind of blasé about it and going, and I don't know where they're going though, but they're out.
No, they're from what I understand, locked down. They're, all of their ICUs are full of patients. Their respirator capacity is overloaded. So I think they get it now.
Well, is it even possible for us in the U.S. to have those what seem to be draconian measures that they had in China in terms of keeping everybody locked down? Because I understand that if you were detected with a fever, you were separated from your family, then you went to a specific place and you were quarantined there, even with just a fever.
Yeah, that's a great question, and that's one that's way above my pay grade. Is for
Yeah.
That's not generally how we operate or democracy operate, but it may come to that. What we're trying to do, we know there's going to be a lot of cases. We're trying to flatten the curve. We're trying to flatten the curve to make sure that the medical capacity has the resources to deal with all the patients that are come in. So we're not overwhelmed by just patients being out and interacting.
Mm-hmm.
Every one of us is taking risks every day with what we do, seeing our family and things like that. But it's, we're trying to weigh the risk and understand this. This is something, we haven't seen and hasn't been seen since the 1918 Spanish flu outbreak.
Right.
We're actually, the population dipped. So many people died of that, and at the same time, at the exact same time, they had World War I raging, or the end of World War I. So those were not fun times.
Well, is that an event that is fair to compare historically, because we're so much more advanced, presumably from a medical science standpoint and whatever? Is that something that, can we compare ourselves to Spanish flu, or is it, not really applicable?
Yeah, one, we know a lot more about infectious disease. Two, we have greater testing about it. Three, we have more precautions like washing hands and things like that. But on the other side, our population is much higher. So there's more of us to interact with each other. So it can be transmitted that way. So there's pros and cons. But I think it's the fairest comparison. And if you go throughout history, you have the bubonic plague in the 14 and 1500s. So there's been situations like this. China did get the SARS epidemic under control a few years ago in 2008, I believe it was. But this is a different virus. And on a positive note, I want to mention, I know of at least 3 labs here in the Longwood medical area that are working on vaccines. So, but that takes a while, but there is hope, and there is, a lot of intellectual capital that are working on the development of a vaccine.
So describe this process to us, the next steps on this in terms of the medical solutions, as it were, to it. We're right now just hunkering down, trying to keep it from spreading. The next step is to develop an intervention, perhaps, for people that have it. Is that something that I read that they're working on? I saw Mount Sinai in New York, and the French or something are collaborating on potentially an intervention, and then there's the vaccine to keep us from getting it. Is that sort of the stages?
Yeah, that's exactly right. They're trying to determine what type of natural immunity we will get for those of us who are exposed that don't get sick, what kind of natural immunity we're going to get for future transmissions of the virus. Or does the virus mutate and come back even stronger? All of these questions are speculation at this point.
Right.
That actually ties into one of our questions that just came in about getting the virus and then recovering it and getting again.
Yeah, I don't think we know that. I think that we're trying to assess the natural immune system. Most people who get the flu won't get it till the next year when there's a new strain or their immune system goes back to normal.
Mm-hmm. Yeah, I'm always fascinated when my doctor asks me if I want a flu shot every year, and he explains that it's kind of a guess. They sort of have a good probability that it's going to be this flu this year that you want to be, but it's not like you get a shot and that it's a blanket clearly, like, that's not the case now, because those of us who have had the shots need to still worry, right, about COVID-19.
Exactly. Yeah, they really, I guess maybe isn't the right word, but they use a lot of science and evidence to see what strain of flu they think is coming down the road for that particular fall to develop a vaccine.
Now, the question I'm sure on everybody's minds is, when can we come out of our holes? When does life begin to resume some normalcy? And I'm sure the answer right now is, I don't know, but I want to hear it from you.
Yeah, I don't know. Okay. So I don't know, and I think, you know, people, the current time frame, I think it's really meant to, so people don't go, you know, really berserk or out of their mind. People are saying every 3 weeks we're going to assess this. People, many viruses, and we're not sure about this one, when the weather gets warmer, it's not conducive to the virus, you know, propagating or to transmission, and we're hoping that's the case. Although there have been outbreaks in Malaysia and Singapore, and even India, where it's much warmer than it is in North America here. So we're not sure.
You know, I think that some of this, well, obviously, a lot of a pandemic is based on people's perceptions, people's fears, and the like. And it just strikes me that it's sort of the analogy of not to minimize things, but you know, once Waze went into effect to help us with our traffic, I thought part of the genius of Waze is that when you get in a traffic jam, your Waze tells you, you know, estimated time in traffic, 7 minutes. And then all of a sudden we start accepting the fact that we're going to be in this for 7 minutes, but with the reasonable idea that this is going to end. Whereas before that, it's like, oh my God, this is never going to end. And I think that's probably one of the things psychologically that we, you know, are looking for and grasping for, and perhaps frustrated about the fact that we don't know. There's no ways telling us this is going to be, you know, 2 weeks, 3 weeks, 5 weeks, whatever. You know, 3 months at this point, and I guess that's one of the things that we need to basically accept.
Yeah, we don't know. We don't know if there'll be a second wave. I mean, I think, you know, we've got to be, as a society, used to the fact that you know, things generally tend to go our way, and things, bad situations in the 2000s can be limited, and they turn themselves around. But this is unique territory that we're all in. You know, a sunny day, we all have usually have nice cars, nice homes, but this is a very different world. This is going to change how work is done. It's going to change your work in the museum industry. It's going to change how people interact socially, and hopefully it'll go back to normal. But some things will change. I think after 9/11. People didn't fly, you know, they want to do a lot of remote meetings, but the technology today is better than it was 20 years ago. The Zoom technology that we're on now is much better. So it will change work, change how universities operate, and maybe hopefully change the cost of college as someone who's worrying about 2 kids.
Yeah.
But I think for the museums, you know, you'll have to change and budget for, like we're doing here at the hospital, wiping things down maybe every 2 hours, and budget for that. Have it part of the normal protocol, where door handles and countertops and things that are touched regularly disinfected, and that'll be an expense going forward.
Well, yeah. So I guess that's a good question about where, you know, we think museums are going to be, you know, like, what do we need to expect once we do emerge from this particular moment, and things, you know, what does it mean to go back to normal? You know, what's the new normal going to look like? Are people going to be, our public, is it going to be super cautious? Are they going to be reluctant to go out, you know, to museums again for a while, or anything, libraries, you know, any of our social and cultural you know, spots, and what can we best do to serve them, you know, as we emerge?
Yeah, I think, you know, that's a great question, and you folks know more about this than I do, but I imagine, again, having a disinfected strategy and time frame, or even doors that maybe automatically open that you don't have to touch, and things like that. But that's a I would imagine, a capital investment in infrastructure that they'll have to plan for. Depends on the type of museum. And, you know, a lot of museums, to your credit, have gone with interactive exhibits. You press this button and this happens, you watch this video, or you interact in this way. And so I think there'll be less touching, less contact.
Well, I have to tell you, it was funny. This weekend I was at Home Depot, as I usually am for different things. And, now I'm very mindful of, you know, how often you touch your face and how often you do this and that. And I was like, okay, my strategy going into Home Depot, I'm going to use my card and, you know, I'm not going to touch anything. And then I realized, wait, I just pulled out my debit card and I have to do this on the pad. You know, it's like, now what do I do with this, you know, as I'm leaving the building. So, you know, those kinds of interactives, you know, touch screen things, you know, that'll be something that we're going to need to really think about. That's been the pattern for many of our interactives in our museums.
Well, that actually leads into a couple of the questions that we have been receiving about how long does it live on surfaces, things like that.
I think that they don't really know that, but they've, you know, for the limited culture, they know it lives a while. It's kind of it's an airborne disease, so it's really not something that you get otherwise. So it's in the droplets. But as we're talking here, I'm talking to you folks, you know, I'll disinfect my phone or the countertop. You know, we can't help but talking. But this is going to impact the future, how technology, I think, is designed. ATMs, we go in an ATM, we have to press in our code or to get our money or whatever. You know, there's other ways that we can do that going forward that the technology people hopefully will be devising, and it'll impact the museum industry and a lot of different industries.
Do you see any longer term? Oh, sorry, go ahead.
No, I'm not competent to talk about that, but I don't know. Who knows if they'll use facial recognition, but how does that museum who doesn't recognize a patron that wants to come to your museum?
What do you see there being in terms of long-term health impacts of this beyond just coronavirus? And I'm thinking specifically of like even mental health issues and things. People are very stressed out about this right now. Is this something that you know, we see that it's going to have a ripple effect through the medical community?
Yeah, already on Monday, I had conversations with 3 members of my team, very well educated, who had a lot of anxiety, understandable anxiety about this, but we all handle anxiety a little bit differently. My wife sometimes tells me I'm in denial about certain things that I could be, but that's my way of dealing it. Other people say they don't want to do anything, go out or do anything, and it can result in a lot of mental health issues and depression even. So we need to just be careful of that and try to reach out and get help. And I'm not saying, because this is not my subspecialty, but if the mental health capacity is really there for our society for this type of situation that we're going.
Well, that's, I think, one of the things that museums are potentially finding very frustrating right now. It's because, you know, in crises of the past, and you think of 9/11 and, you know, other types of, you know, crises that we've had, museums have always been sort of that gathering spot, a collecting spot, a place that actually helps people, you know, find some solace and peace and refuge and those types of things. And we're not able to do that now. And, you know, we're literally closed. And so I think that makes this whole experience for us as a society, even this notion, the phrase social distancing, you know, it's like we want the opposite of that right now. We need that, and yet we can't. And so we're casting about as a field about how do we, you know, do that from afar? How do we do it, you know, virtually and the like? And I guess that's something that, you know, as the days move on, we're getting creative. I know that in conversations that I've had, but, you know, that's one of our primary roles in culture, in society, and we're not able to do that. What else do you think we can be doing now as a field?
So that also ties into a question that we received about just sharing information about COVID-19 we as a museum field share that information, or do we leave it up to the professionals? Because we really don't want to start sharing, spreading misinformation, because that's bad.
Yeah. Do we need to spin anything? I don't think so.
Yeah. Point, Heather. I do think you should fact check everything. There's still a lot of rumors going around on this. I would get it from any information that you might want to share is from the CDC. But what you folks already know, there's so much information, like use common sense, wipe things down, do social distancing until we're told otherwise. Mm-hmm. And your other comment, what I've been doing is every time I'm in the car, I'll call someone else, a family member, a friend, just to check in. Yeah. And I do it under the guise that I'm like checking in on them, but I'm doing it for myself, because I can't be with them. I'm just kind of connecting, hearing their voice. So I think we all need to do that.
Yeah, and then speaking of connecting, we've actually gotten a couple questions about this one, about paper, because we all get mail at work or at home. How should we go about handling that? Like, because I keep thinking about like, oh, I should go check the mail in the office because I could walk over there, and I'm like, well, I don't know if I want to do that or not.
Is that why you told me to go check it?
Maybe.
Yeah, I haven't heard. That's a great one. I mean, we're not a paperless society yet. I still have a lot of paper here, and or our own clothes or anything. We still have to do stuff. I think we just use common sense and wash your hands after even checking the mail, not knowing where it's been.
What are some of the, sometimes the little things count. Masks, for example, we're getting mixed signals on masks. How are doctors dealing with either the lack of masks? And I've heard that people are driving up to emergency rooms and stealing masks in order to sell on the black market. Is there a black market on this kind of a thing? And
well, yeah, I think we haven't had that situation. What we do have, and this was as of yesterday, sent out clinical protocols about how and when to reuse masks because of the shortage. Yeah. Getting during the entire month of January, before a lot of requests from our colleagues in China, please send us a case of masks or create a case of masks. Now, the U.S. population, if you can believe this, is small compared to that of China. They have about 4 times as many people as we have, so they were really in need and running out of masks. In fact, the Brigham and Women's Hospital sent over both a bunch of masks, but a bunch of protective equipment that they should use, personal protective equipment. They have a lot of, we'll see that now more in society, like you do over in Asia, in China, and Japan. Just when people are well, everyday people wearing masks around, or getting masks that are disposable, that they can wash, or disposable masks are reusable, I should say, that they can throw in the laundry and wash and reuse again. So that'll be more, how we see people. If for anyone who's ever been over to Asia, that's how they've been living for years.
Yeah.
Part of their attire.
This also is kind of a follow-up question, because I know, I do have family members that are in the medical field as well. What are the protocols for healthcare providers that have been treating patients and coming back to their roommates and families?
Well, there's actually, I'm not going to break any HIPAA rules, but we do have certain people who are exposed and have to self-quarantine. Okay. Yeah, and they can decide whether they self-quarantine by themselves in a hotel or they self-quarantine with their family.
Dave, switching gears just slightly, a lot of our museum spaces have outdoor landscapes and the like. That seems to me that that's something that folks can stress, that's still an okay, at least right now. Social distancing means that you can still walk our spaces, enjoy our outdoor areas, recreation and the like. Is that something that's kind of an opportunity for us?
I think that's a great idea. Probably the safest thing you can do is go for a walk or a bike ride on a trail, or go to a park, and go with someone that that you would already have been exposed to or something. Okay, I think for 2 or 3 people, it's large gatherings, and that's when exponential math starts to take place that can increase your risk. But I think that's a great idea. Go outside, parks, any external space that your museum has is wonderful.
Right. I think people are going to be thirsting for that type of thing.
Really starving for it, I would agree.
So Heather, what other questions do we have from folks? Let's hear from you. And
we do have some more museum related type funding questions, but I think we will be doing some follow-up webinars to really answer those questions. I think this webinar was more just about the immediate right now. I think some of the questions that have been coming in are very valid, and we will be talking about those at later discussions.
All right, so wait, I got another poll. Wait. So here's one I want to hear from everybody. I am most concerned about health issues, mine and everyone else's, economic fallout, and working from home. Because that's one thing that, the economic piece of this is something that, of course we didn't really talk about, but I think that's part that I'm hearing, we're feeling as though it's a 1-2 punch. We now need to deal with the sort of the essence of the disease and, this sort of shock that we've had where suddenly we're thrust into this atmosphere of panic and whatever. But the bigger sense now is that the fact that, the longer term economic fallout, what's going to happen with my job, what's going to happen with my museum, where's the money coming from, all of those kinds of things, are very, very important. So it looks as though, half of us most concerned about health naturally, but, getting up there is the economic fallout from people as well.
Yeah, that's a great point. I mean, this has really already hit the restaurant industry, and there's a lot of layoffs there for people who are living paycheck to paycheck, hourly paid workers. So the aspect of people not coming in, and then there's the aspect of the stock market falling. I think we just need to, one, try to be civil and nice to one another as we get through this, not as just a region or a country, but the whole world, and out. So there's enough food in this world for everyone to survive. We just need to be generous with it and save, and support restaurants that have takeout. But they're the organization that I've heard has been already in a week, really, a lot of layoffs there. And people face that too.
That's another, I think that's going to be something that we as a museum field need to address, not so much in what our collections and exhibitions and whatever, but from our community support role, the sort of social activism role that we all play in our community, the social capital that we have. What can we do to advocate for our communities and the citizens that most need our help? And I'm certainly envisioning, as we come out of the caves, there's going to be that community gathering spot for town meetings, for advocacy, for who knows what, even food pantries. I'm imagining, we could be playing a role there, potentially even with our outdoor spaces. Do we become testing sites, if need be? I mean, you mentioned World War I and the Spanish flu. You see those pictures of tents in places. Is that something where, worst case scenario, are outdoor spots, places where we go to quarantine people? I don't know, but there are a lot of things on the table.
The different scenarios, and I think that would be the worst case scenario. But I think that anything could really happen. But I just think we have to hunker down and be safe and see if we can limit the transmission. And then those of us, working on a vaccine to make sure that we get that sooner rather than later with the current biotechnology and informatic technology that we have.
Yeah. Heather, any other questions?
So a lot of us are working from home now, but what about museums that close to the public but still have their staff coming in? Is that a smart idea, or how should we handle that?
Yeah, I mean, it depends on the museum. Do you need to take care of animals or things like that? But I would highly recommend that people don't come in at all or don't interact with one another. We need to and in the future we'll deal with the economic impact of all this and fallout. This is a new world. It'll change how we work and how we interact and how museums operate. So I think some kind of having more discussions amongst yourselves about what could we do, what's successful, and how do we survive with the great resources that you are providing to the public. How do we get them out there, get movies or videos out there? All of us are figuring it out. Those are issues for both now, but in the future. The main issue is really to stop the transmission of this pandemic.
How about UV cleaning machines? Do they work to destroy the viruses?
I am not sure. Usually UV cleaning machines, so with infectious disease, usually viral or bacterial, and usually UV cleaning is probably better for bacterial infections. So I think you need really to wipe stuff down with an antiseptic.
Yeah, and I know that our field is definitely going to be grappling with those questions because there's a lot of stuff in museums that cannot be wiped down with those types of materials. So I think, because that was a question that actually came up earlier, that we're still all trying to figure this out right now. And I don't think anybody has any answers at the moment, unfortunately.
The stuff that I think you could focus on now are door handles, countertops, things like that. Bathrooms, get that on a regular schedule.
Yeah.
Think about those historic houses with wood that's from, the 1600s. What happens there?
Yeah. I mean, we're all trying to figure this out at the moment. It's stuff that, we could try to envision 10 years ago, but, we're all facing it now. So.
Yeah, and this conversation, if we had it in a week, could be a little bit different. And even Dan, since we met last Thursday, the situation evolved. So it's a moving target at this point.
Yeah.
I can envision a new position in museums, or at least a consulting field that actually addresses some of these deeper, issues of cleaning and how to keep, because that's going to be, I think, part of, maintaining our trust with the public, that they're coming into a reasonably safe space and that we've, taken every measure possible for their health. That's probably going to be a long-term, type of thing, at least for us to know about how to do it ourselves, whether or not it's a position or a consultancy type of a thing.
Yeah, I do have another question. Is it possible to speculate on when we will know if we've effectively flattened the curve?
I think we're going to know within the next couple of weeks. Yeah, based on the number of cases. Again, we don't even know the true number of cases. We're extrapolating that on the number of tests that have been given, but not everyone in society has been tested. Again, in the state of Massachusetts, we have about, I think, 250 confirmed cases, but extrapolation, they think in our state, it's probably about 6,500.
Mm-hmm.
Yeah. So what is the average amount of time for hospitalization if you're admitted? And knowing not everyone will need hospitalization. I know that's something that we're all grappling with, watching things that are happening in Italy and Spain and here.
It completely varies. It varies by your age, if you've taken care of yourself, if you're immunocompromised, if you've been a smoker, if you have other respiratory diseases like COPD, chronic obstructive pulmonary disease, how your immune system, and if you're on any even non-oncology immunosuppressors. So there's no right or wrong reason.
Yeah. So I know this was probably a question that was kind of answered a little bit earlier about we're doing this whole 3 weeks out type situation of like, we're going to reassess this in 3 weeks. So this is probably more of a crowdsourcing one. If you guys want to put this into the chat feature, is like, how far out should we be canceling programs? Is summer programming in jeopardy? I know this is an answer that we don't have at the moment, but I'm just kind of curious if you guys want to type in the chat how far out you've started canceling your programs.
Yeah, Yeah, that's something for you to consider. To put it in perspective, Dana-Farber, we have an event called the Pan Mass Challenge, and it's a weekend bike ride in the first week of August. And just to let you know how much it impacts our bottom line, for that weekend bike ride, we get $60 million from that. So $60 million, a real number that is going to impact whether we do layoffs or not, or can do the research that we're supposed to do. So we're very worried about that. As of right now, we're not canceling it, but that's August. If it were May, we probably have to cancel it.
Mm-hmm.
Yeah, like the marathon. There's a bunch of walks that I know have been canceled too, just because it's not worth putting that population at risk either.
I hope this was helpful.
Yeah, it definitely was. Have we extinguished most of the lines of questioning, Heather?
There's still a couple questions, but I think these are questions that will probably need to be answered at later webinars as we have more information coming in. Right now, there's just so many unknowns about how the museum field in general, dealing with operations alone. We just don't have the answers at the moment.
So on that note, I'd just like to throw out there to everyone listening that one of the things, as I mentioned at the very beginning, you know, we're sort of on the job trying to figure out ways to best keep our community connected through things like this. And we're devising a series of ongoing potentially some webinars that are discipline specific, you know, like for educators to have some conversations about what's happening, and curators and the like. So, you know, we're trying to figure those out. If anybody's interested in sort of helping us think that through or facilitating that, please let us know, because this is, you know, a great platform for those kinds of things. I've been doing some series of small group meetings with executive directors to kind of find out what's going on. And I think that that's also, you know, sort of the smaller group things where you can have more interaction with each other is something that I'd love to help facilitate. And then we're also doing just sort of our general meetups. We're trying to come up with some happy hour ideas or meetup ideas for just, and we're sort of organizing those by area. So have we announced it yet? We're doing a North Shore meetup next week, I know, and we're
gone from one webinar to another this morning.
Right. So yeah, but you know, the idea though being that, you know, we want to offer people opportunities to engage with each other on these, you know, on a smaller basis as well, so that we can stay in touch the best we possibly can. And you know, moving forward, our commitment is to try to, you know, continue to connect people and provide that bit of glue. Even if our formal face-to-face events are going to be off a little bit later. So Dave, thanks so much for participating. Really, really grateful for your time on our behalf, and we'll keep you posted on how things are going in the museum field, and good luck out there fighting the battle on the ground. We're trying to do everything we can to support what's going on in your field, but we're really grateful for all of the you know, frontline support that you've got in the battle for us. So thank you, Dave, for being with us.
Yeah, thanks, Dan, and thanks.
Reed.
Happy to do chat with you guys in the future as needed.
Okay, excellent. Thanks everybody for being with us.
I should mention though, just a follow-up, is that I did have a question. It was today's meeting was recorded, and it will be available on the NEMA website because it was limited to 100. So if some of you guys know people that tried to get in that weren't able to do that, so if you want to share too, so it will be available later on.
Hang in there. Be nice to one another. Be nice to, you know, people you interact with, and wash your hands. And that's basically what we can do. And of course, social distance.
Yeah.
Yep.
Okay. Thank you, Dave.
All right. Thanks, everybody.